Have you ever wondered, should I be icing or should I be putting heat on an area where there's pain or discomfort or swelling? I'm Dr. Jen Anaker, owner of Anaker Clinics of Chiropractic. In our office, we get this question a ton, and so I hope you find this helpful to be able to see one of the things that I tell my patients. Now, I will tell you there are some different philosophies on this. I will also say I do not know your story, so certainly it will be something that you need to consult a professional, but I'm going to give you a few key things to think about. I tend to lean more on the side of icing. A lot of times, when people are in pain, something just happened, or certainly it's risen up to that next level. So a lot of times there's a lot of inflammation that's going on in those areas. And so when you're icing, it can be used as a tool to be able to reduce the level of swelling going on in that area. So what if instead something was very acute and you said, okay, I'm going to get into the hot tub, or I'm going to add heat to that, is that heat, comfort-wise, may feel good for maybe, we'll say 30, 40, 45 minutes, but then because again, there was already swelling going on in an area that isn't doing well, that heat is going to bring even more swelling to that area. So you might find after that 30, 45 minute time period that what felt good now feels worse. So I would tell you overall, if something just happens, err more on the side of ice. In our office, oftentimes our instruction is put ice on for 15 minutes, so maybe 4 to 4:15, have a bag of ice, have frozen vegetables, whatever that is, on the area where it is tender. And then from, we'll say the next 45 minutes, so 4:15 until 5 o'clock, take that ice off and do it again at 5 to 5:15. And I always tell my patients, it depends on the case. So again, please know I don't know your case, but some things to think about. Do it a couple of times during the day. Heat, when that's used, is more so if you have a chronic problem, maybe you've had low back pain for 20 years and it's just bothered you every day, for the last 20 years. That may be a time where you want to bring a little bit more blood supply, because as something is more chronic, that blood supply will leave that area. So that may be a time to use heat. But I tell my patients overall, they err on the side of ice. And certainly, yes, when something just happened, but also yes, when we're beginning to adjust an area, starting to ask the body to be in a different place, have different ability to heal in that area and or to bring swelling in that area as part of the healing process, we're leaning a little bit more towards ice. So heat versus ice, I tend to lean more towards ice, but again, a conversation for you personally to have with your healthcare provider. Again, Dr. Jen Anaker with Anaker Clinics.